I met Alejandra in the toilets in the break. The best conversations happen around the toilets. And we discovered that my son's life was saved because of a hospital in Memphis called St. Jude. And apparently Alejandra has also been doing work with St. Jude. I think an interesting project may well be born from this conference and from meeting in the corridor. I feel it already, very, very strongly, because it's all about resilience. And the most important message is to be proactive. Resilience is solo, but proactive resilience requires other people to be a catalyst. So for me, it was my doctor saying, I prescribe a walk. Everybody in this room, if you've been in silent despair, know it takes one thing, and that is the catalyst. And so with that segue, gonna hand you over to my new bestie, Alejandra Mendez, who, like me, is a mother of a childhood cancer survivor. She is awe-inspiring. She's got great stories, as we heard from the rapid fire. And she is going to chair our panel, where we're going to dive into the topic more of silent despair. Here we go. Over to you, Alejandra.
Thank you for having me here. Thank you, Peter. Thank you, Ilona. So before introducing the fantastic people that's going to be sharing this panel, I want to see what is advocacy? Because we're going to be talking about advocacy, and that's why we're all here for. So what does advocacy mean in different cultures, in different languages, in different regions? Those of you who speak Spanish here, as my native language is Spanish, know that we don't even have an accurate translation for the word advocacy. We talk about abogacía, maybe the Spanish speakers would know, but it's not exactly. So it's hard to define what advocacy is in different languages and, of course, in different settings. In some settings, it simply means that the patient's voices need to be heard by doctors. In others, advocacy means that patients look for public policies which improves their patients' and their families' lives. In the old days, we all know that the physicians or the doctors were never questioned, right? Patients were not expected to express feelings or expressing doubts, even asking questions. The doctor's remarks were considered certain, doubtless, irrefutable, that's a hard word, and unmistakable. Right? Happily today, things have changed in most settings, where patients have now a voice and it's becoming to be heard. Therefore, in many low-income countries and low-medium-income countries, settings, things are still like the old days, and physicians just not listen to the patients' voices. So you know that different regions face different challenges, right? In underserved settings, the challenges are access to care, early diagnosis, cost of treatment. You know, there's no insurance for cancer patients. Access to clinical trials, very hard to find them. And of course, to be heard by the medical team. In some developed settings, challenges are the quality of life of survivors, laws to prevent discrimination, long-term follow-up care, mental health support. And unfortunately, in some places, it is still the right of patients to be heard by the medical team. So whatever the challenges are in the settings that we live, advocacy is crucial. To advocate means to identify the challenges, make them visible, and work for a change, whatever the challenges are. Patients from all different settings need to stand up and raise awareness of their challenges. Find a way to break the barriers and make things happen, as we've been talking here. These issues will be discussed in this panel. The panelists here share what they do. They will share what they do in their part of the world to advocate for their challenges. Each of them will share what are the greatest challenges in their regions and what are they doing and what are their main achievements to address them. So I want to ask Franklin, Barbara, Carmen, and Parag to come here. Okay, so I'm going to start with a brief introductions. Barbara, I think we all know Barbara. She's been since 2013 in the Inspire to Live family. After being misdiagnosed for 6 years, she was finally diagnosed with cancer. She says that she's not a scientist, but an advocate, and a very powerful one. She's she's part of the Bowel Cancer UK, DICE, European Colon, EAPM, EMA, and NICE. So what I was struck when I read her bio is that sharing info is the quickest way of saving lives. I'm also going to introduce you to Franklin, senior radiotherapist in the Ocean Road Cancer Institute of Tanzania, founder of Tanzania Cancer Society, board member of Tanzania NCD Alliance, also an artist, I learned. And I was struck by a quote by Franklin say that every person in Tanzania should have access to the best possible care to lower the risk of getting cancer, to improve survival rates, and to have the best information available. I'm also going to introduce you to Parag Mankekar. Parag is co-founder of Real Lives Foundation, has dedicated over 16 years to spearheading the development and global scaling of real-life simulation, a groundbreaking tool that connects education with real-world challenges. His work is driven by a deep commitment to youth leadership, social entrepreneurship, and fostering empathy, cultural awareness, and sustainability through innovating gamified experiences that align with the Sustainable Development Goals. And at last, Carmen, she sent me her bio. And my apologies because I had prepared bios for different people. They changed me. So, Carmen Monge is a dedicated cancer advocate, researcher, and person with a lived experience of Hodgkin's lymphoma diagnosed at 24. She's from Costa Rica, and she has lived in over 6 countries, gaining a global perspective on cancer and advocacy. Her experience as a migrant has shaped her understanding the challenges faced by youth cancer survivors across different cultures and healthcare systems. Carmen focuses on amplifying the voices of young people affected by cancer, particularly in areas like equity, diversity, and inclusion. She's an active contributor to Youth Cancer Europe and works for improving the quality of life of people with lived experience. Something interesting, and I'm very happy to share this, is that she's been instrumental in advancing Costa Rica's Right to be Forgotten legislation, inspired by similar efforts in Chile and in Europe. Actually, Chile is the first country in Latin America who got the right to be forgotten, and I'm very happy that Costa Rica is going to be the second one, right? In addition, she's the co-author of Can Can, The Adventures of Ming Island, a children's book series that aims to reduce the stigma around cancer and support children with this disease. So, with that presentations, who's first? Let's see, Franklin?
Yeah, good afternoon. My name is Franklin, like it has been introduced here. So my take on the topic of today, the silent despair, speaks even louder to those who have the information and not doing anything with the information that they have. Being a product of from the streets, is in communities, I am privileged enough to have gone through the educational system to empower myself with the knowledge and demystifying all the myths that I have encountered during my growing up. Because as an African, we learn from our parents, our neighbors, and the elders and many other people in different ways. So as you grow through the educational system, you came to know the truth and what's not the truth, and that's how you grow up and become a professional. So as a medical practitioner, I didn't know a thing about cancer from the mainstream, from the scientific world, but I knew and I learned it from the people around me. So in our societies, anybody older than you is perceived to have a knowledge and knowing the truth. So I believed in everything that was said in different ways and formats from colleagues, from the peers, like I said before. So as I climbed up the ladders in education and I was in medical school, I didn't even know enough about cancer as a disease that can be curable. So I even graduated knowing that what they are saying in the scriptures and writings and everything that I'm learning from the professors is not really holding true to the reality of the street. And that's the community. I'm sorry, I'm hip hop. So sometimes I call it the streets, the place where I'm from. So I didn't really know exactly what's going on in the cancer world. And so the majority of the colleagues that I've been with in schools, and many people didn't even want to work at the institutions where, the cancer facilities. But I happened to be employed in that place. It's Ocean Road Cancer Institute. It's the largest in the country. And we were very few radiation therapists in place. And what I encountered, to cut the long story short, is that I had been facing patients at the very late stage, as I understood. And then they lack a lot of information, something as simple as information, knowing the symptoms, what to do and where to go. So I was in silent despair that I knew something, because when I was employed, I learned more about the reality of cancers, and I knew what exactly can be done to reduce the burden. But when I look around, I see my colleagues getting busy to treat what's available and then and trying to do the best, become the best doctors and specialists in cancer, waiting for people whom, if only you said something about the early detection and stuff out there, they would have come even earlier, and you would enjoy your profession because you will be treating to cure. But now, 8 out of 10 people were late, and definitely they were going to die very soon. So I was asking my colleagues that, you know the reality, you know the truth, why don't you tell them, create awareness programs and educate the people? So they have many reasons, and one of them being they are the only ones who are dealing with cancer in the whole country, and we have a lot of people waiting on the list, so we are busy treating them, but a few never even thought of going out and say something. So they thought it belonged to someone else. The awareness belongs to someone else, but there were not too many people in cancer field. So as I was lucky, I knew some things, and I felt the despair could be even worse if I just stay with the information I have. I had to try to answer the questions to different people. Then I had to create platforms to create awareness, and I came up with an idea of creating the saratani.info website, which was largely a platform where you can get the right kind of information about cancer and everything involved in it. So I registered an NGO, the Tanzanian Cancer Society, because I wanted the sustainability of the programs that I think I would have to offer the society. But then it was difficult to get people to the internet, because the way our people learn is through listening to each other and gossiping as well, and music and entertainment and many other things. So WhatsApp and other social medias became prominent back then. It was 2016. Then when we decided to create the WhatsApp groups that would lead people to the website, because people were not going to the website to get the Swahili translated versions of cancer information, but they would rather listen to each other in the WhatsApp groups. So I had to create a WhatsApp group with the same name to the website, so that once you hear this name and you want more information, you can go out there. But people preferred the WhatsApp groups. So we created randomly a link that would enable all those who are interested in knowing about cancer, because first of all, we were invited in the groups. We invited ourselves in the groups. So we educate them. And then for more information, you can follow this link so you can become an ambassador. So in our main group of ambassadors, I had a team of volunteers who knew something about cancer, their co-workers and even medical students. So they acted as moderators to educate people every weekend about certain types of cancer, especially the top 10. So it was easier to get different kind of people from all walks of life in those groups. And those were particularly interested to become the ambassadors. So we were educating them and we urged them to spread whatever education they had from us to other WhatsApp groups. And we had like 10 groups so far. And basically we kept doing that, and we believe that we saved many lives, because by so doing, we spread the right information to the right people. And now we're still doing that in many ways. And now the next challenge is to involve the community health workers in this as well. So it's a challenge that I've been trying to help resolve, and I hope it's doing really fine. And what we are lacking right now is that we want the sustainability and the funding to make sure that we educate them through different formats. You know, we only write texts and then some audios, but we need to have more professional tools and even media for different kind of audiences, because not everyone wants to read. So we're still working on it.
Thank you. And what I'm going to say follows on quite nicely, I think. The power of patient education. Hello, everyone. I'm Barbara. I know what it's like to be told you've 3 months to live. There's no hope. That was 18 years ago. In November 2006, patient education and awareness played a crucial role in my journey. I was diagnosed with colorectal cancer with a tumor in the ascending colon and a 15-centimeter tumor in my left liver, and then recurring in the lymph. When I first heard that word cancer, I was thrown into a world in which I knew nothing. And I felt I had so much to do in such little time. Like many cancer patients, I had a lot of questions to ask, but I really didn't know where to start. I remember Mark asking questions in the hope of getting some reassurance. But the words remained unechoed. There's no hope. It was after midnight. Mark went home, and alone in the hospital, my first thoughts were, 3 months is not long. What am I going to do? I want to write my thoughts down. I might suddenly die. So I wrote letters to my 2 sons and to Mark, and I wrote a poem called Written on the Night I Was Told There's No Hope. It took a long time to get the test results, and even longer for that first appointment with my oncologist. Only palliative care was offered in the UK, chemotherapy. After 4 courses of this, and the effects of the treatment diminishing, I really started to feel there was no hope. And this is where it could have ended. And without the internet, it would have done. Patient advocacy was not strong in 2006, but the good thing about the internet is that you can find out what's happening in other parts of the world by yourself. Education changed my journey. And then came empowerment. Finding a way of breaking through barriers to attain that treatment that was not available for me. There were biological treatments being used at the time in Europe and America that I had not been told about. I asked about them, and I was told that I could not have them. Time was precious, and so we paid for the treatment ourselves. We were lucky. It shrank the tumours, allowing resection, and saved my life. I started from a point where I knew nothing, really nothing. Finding that information gave me the strength and the ability to question my treatment. I was so surprised when my story became national news. £21,000 to save a life. Why were they so interested in me? There are lessons to be learned. My actions helped me, but they also helped many others who followed the example. I had letters from numerous patients around the world asking for help. So how can these simple key lessons be related to lower middle income countries, where patient education can make a difference to their care? We know that first steps to reduce unnecessary deaths from cancer are prevention, diet and exercise, and then awareness of symptoms, enabling early diagnosis. And so many people in low middle income countries own mobile phones. Though we can communicate with them, we can send information, though it must be sound information and clear for the people who read it. But patient education isn't just about understanding the disease and treatment. It's also about knowing what to do when you have symptoms. People in lower middle income countries often cannot take that next step. They need an infrastructure in place so that they can. So I believe the way forward, from what I've learned, patient education and awareness should be an ongoing process. It's not just about a single pamphlet or a visit to the doctor. It's about continuous learning, asking questions, and being actively involved in your care. So firstly, we have to make information available. Every patient has different levels of understanding. It's important to tailor education materials to their individual selves. Secondly, encourage patients to ask questions. Patients need an environment in which they feel comfortable to ask questions, no matter how basic they may seem. And thirdly, to provide emotional and psychological support. It's important to recognize that emotional support is as important as education. So in conclusion, empowering patients to understand their disease, navigate their treatment options, and make decisions with confidence must all be in a structured setting. Being an active participant in my care made all the difference in my journey. And that should be the priority of every cancer patient, everyone, no matter where they live. It is our responsibility to ensure that is the case for all.
I can go. Thank you. Are you ready to hear the roller coaster of emotions? Well, I was diagnosed at 24, as Alejandra said, in Costa Rica. I was lucky enough to be treated in Costa Rica because we have social security system. So that meant that all the treatment was covered if I was working. And that was a very good luck because every session of chemotherapy was around 6,000 euros per session. And my salary at that moment was 1,000 maybe. Definitely, I couldn't cover with my salary. So, as many of you that are people with a lived experience, the moment that they tell you you have cancer, you have many thoughts. But as a young person, what I thought is like, oh no, I'm going to be the sad girl in the movies, right? Because that is what we see. That is the stigma that is in our minds. All the movies that when somebody is sick, they just talk about the bad things. I know there are many bad things, like the nausea, loss of hair, that all the family is sad. But at that moment, I didn't want to feel like that. I didn't want to feel like the poor friend or the poor daughter or the poor, I don't know, fiance. I wanted to say the good things that also cancer brought me. So without thinking, in that moment, I start as an advocate. I start writing the good things that cancer brought me, actually. It made my family together, like we were stronger. Also, I didn't have to shave for 8 months. And that for a woman is like a luxury, like. And I had the time to prepare my wedding. Not too many people have that. So I just started saying the good things that I thought. So I finished the treatment, and suddenly I didn't want to talk about that I had cancer. I didn't talk about 3 years about that. Why? Because since the beginning, I thought like I was broken and I'm a little bit faulty. Since the moment that my doctor told me, okay, don't be surprised if your fiance leave you or if you lose your job. And at that moment, I thought like, okay, I'm not going to be the same as my peers. I'm going to be some kind of a disadvantage. So every time that I meet a new person, I'm not going to say like, hey, I'm Carmen and I had cancer. Because not. I didn't want them to see me like that. And many of my friends back in Costa Rica saw me like that. So I had the opportunity to live abroad in many countries. And I tried the healthcare system in more than 5 countries as a patient or for my work. And I never told my new friends that I had cancer. Until after 3 years, that was my lowest point. I started having panic attacks. I thought that the cancer was back. Why? Because I was losing weight. I have the night sweats. Everything happened to me. Like I was really nervous about it. And I started crying in churches in Ireland. I didn't want to talk with my classmates because they were young. They wouldn't understand what is to have cancer when you are young. Because cancer is for all people, right? That is what you think. So in one of these times that I was crying in a church, I saw one of my roommates and she was so surprised, like, Carmen, what is happening to you? Like, you are crying. And I have to tell her. I have to tell her that I had cancer. And I was afraid that the cancer was back. And she was like, okay. And I thought like, oh, probably she didn't understand. Maybe my English is not really good today. So I told her like, yeah, I had cancer. And she was like, okay. And I was like, okay, she's not making the normal faces, right? The pity face, the worry face, or the I don't know what to say face. And I asked her like, why are you so chill about it? And she told me, it's just that cancer is not new for me. My mom had cancer, my grandma has cancer, and since I was a child, they told me what is cancer and how to talk with people that had cancer. And I thought like, oh, wow, that is what we need, right? And she really helped me. Like she went to every appointment with me and she was an amazing person. And everything was like, well, I didn't have cancer again. I was sweating in the night because the heating was running my apartment. And too many things, but without her, she was the main person that helped me to go to the appointments, to make me relax. Without her, I would keep going to churches to cry. So in that moment, I realized, okay, definitely we have to do something. We have to talk about cancer since we are in a young age. So I did 2 things. For one of them, Alejandra helped me. Her son helped me as well. I just started a YouTube channel where I interview cancer survivors from around the world. And thank you to this conference, I interview 4 people more, I think so. So networking works. The other thing that I did was to write Cancan and the Adventure of Ming Island. There is a children's book for children from 7 to 11, but also all their population have read it and have learned something. And it's about the holistic cancer journey. So not only the physical, not only the treatments, the loss of hair and everything, but also the social and emotional effects that cancer can bring. Like how to tell a parent, how to tell a friend that you have cancer, the loneliness, a little bit about life. So that is the other thing. And I don't know if I have more time. I have more time. Or no? No? Okay. The only thing that I'm going to say is that also I work a lot in EDI, Equity, Diversity, and Inclusion. And this is a passion. As a patient that was a migrant, it's very important to make included to other patients that are from other countries. Because entering into a healthcare system is like entering to a home of a friend of yours. Like you are going to open the door, you are going to let them in, and you are going to explain everything to them so they are going to feel welcome and they are going to feel like they are in their own home. The same happened with the healthcare system. When you're a migrant and you go to a hospital, you don't know what to do. You don't know where the toilet is. You don't know how is the healthcare system. So for this, I invite you to welcome the people that is a patient and a migrant in your own countries. Thank you.
Yes, so I'm Parag. Life is a game because life is random and life is chance. And I firstly realized as a child because my grandfather apparently died with cancer in 1936. And my father, I had a daring, sometimes I asked him that why, what happened? And he said he was just 9-year-old. And he said that he could not get any treatment because he was quite away from the major cities in India. And of course, in major cities of India also had no health care. And when I heard this story, I looked at my father's life because he lost his father at age of 9. And then I know that throughout his life, he had to struggle to make my family what my family is today. So, the entire generation of his life, he died at the age of 93 with COVID 3 years ago. But that was his life. And when I looked at it, I said, this is terrible. Like the entire generation, one generation is gone into making a family is really a challenge. I became doctor and I started a practice in a very small village because I used to do a lot of mountaineering and trekking in my life. And this was just 60 kilometers away from my city, which is Pune, near Mumbai. And I could see patients coming even 20 kilometers walking. So people used to carry the patients on their back or something. And this was 1986. This is not very far away. And this is what I saw as a young doctor in a village. And I could not believe. And when I was doing a lot of thinking about the despair and the conference topic, I realized that we healthcare professionals, and of course patients also, we have 300 times more possibility and chance of getting despair because we go through these situations in a big way. What is the importance of a project like Inspire to Live? I met Pierrella, Peter and Ilona in China, Shenzhen. Again, it is a chance and, least probability how you meet people. And because Stephen is a good friend, he invited me to China and that's how we met. And since then, I am studying Inspire to Live as a very passionate organization that there is an undercutting layer of empathy. Even in Daniel's presentation today, he did not use the word empathy, but the entire presentation was on empathy. The next presentation by Egg, I met him because my life changed at CERN in Geneva when I was Erasmus Fellow in Europe. And the tagline on the CERN organization was where internet is born. This is a British scientist who invented www and who gifted that to the world without taking the patent from London. So CERN, and he also spoke about how his experience as a young person going to Zambia where he was born, and he could not believe himself, like we all saw the photo. Now, this is the experience nobody has in the education today. If education was really talking about empathy in a big way, we would not write this sentence, if about us, not without us. This is insult to humanity, why this should happen in a world which is so connected, which uses technology, which has to be empathetic, because mirror neuron is the gift of the God. It's like we all use mirror neurons when we talk to each other, when we connect to each other, and when we want to do something together. Now, this shadowing happens because of the education system, which is driven by marks, which is driven by competence you have, and because you are born somewhere in New York, Mumbai, or Seoul, or the cities you are in. There could be a child in very remote Africa or very remote India who is equally gifted, who is intelligent, who has all the kind of resources in his brain, but just because there is nothing around him or her, she cannot become like you and me. Now, this is a chance we don't teach in the education. And the same chance we are not teaching as doctors in education. And that was my talking about how the syllabus of medicine doesn't even talk about empathy. It's all about anatomy, physiology, and techniques and technologies and MRI and CT scans and all sorts of things. But there is not a course. Only UK and some other universities are trying to teach empathy into the medical courses. Now, this is the greatest challenge, I thought, in the world. And I left medicine after designing 3 hospitals in India, which was difficult, for a family like me. To create hospitals is beyond somebody's imagination. People fooled us. They said, you are all young doctors. Nobody will come to you as patients. But the only thing which worked was honesty. Only thing worked was business model, which talked about the poor and rich patients together. And the third thing was all the young doctors wanted to change this world. So these 3 things, which is a good city in my part of India, really worked. And since then, because of this experience in village and because what I could see in the hospital, like one of the biggest hospital I was part is now 1,000-bed hospital in my city, which started with only 20 beds in the hospital we started in 1993. So just in 40 years, we grew from 20 to 1,000. But over the years, I saw the corruption. I saw the way the pharma companies are really making doctors corrupt. Everybody wants to earn money very fast, very swiftly, without even thinking about the ethics and emotionality about everything. So I think there is a big deficit of empathy which happened. And that's how I shifted from medicine to IT. And I started my company about 30 years ago, in 2001, 20 years ago. And I think we are making a big impact in this world by bringing the empathy discussion in the forefront. I'm happy that today, if I really want to calculate the empathy quotient of this room, it is much more, I think, 1,000 times more than what the Amsterdam city or what the world is all about. And this is this is a good thing that we are sitting here talking about empathy in a big way, but it's also a sorrow that the rest of the world is not really empathetic. So how we can make empathy a kind of a precursor, trigger, or a kind of a fundamental value which can really make the things. 2 things really changed. A lot of things changed actually, because I meet so many people when I travel and when I go from village to the big cities. So one person who met me called Christopher Livingston, who wrote a brilliant article on my game in a very powerful magazine called PC Magazine, which is PC Gamer. And this is an article he wrote after playing my game. And one of the conclusion, I still have that article with me. The last sentence he wrote, that I died with breast cancer at the age of 60, but at least I did not die at the age of 3 with malaria. Now that tells you the story of how this world is all about. And I say that cancer, of course, is a very big challenge in this world, but there are people who are dying with diseases which they should not die about. So that's again, another thing which is like undercutting of how the medical discipline is not empathetic at all. The second person I will always remember, I will always respect is Lee Hartwell, the Nobel laureate. And actually I got introduced to him by Stephen Friend. And he kept inviting me to Arizona State University, where he works as a director of Sustainable Institute. He's a director there. And suddenly one day he said, Parag, let's go for lunch. And I could not believe that I'm sitting with a Nobel laureate for almost 4 hours. And he was narrating me the entire story of his life, from his birth to what he is today. And he said, Parag, I need to admit one thing. And I think he was 77 or 78 that time. He said that, Parag, I missed doing a research that how empathy can be one of the greatest precursor of outcomes of the diseases. And, I literally cried that this is how the empathy is kind of neglected. He said that. And then the third person I met was, I'm just giving you some small examples of stories I am encountering. So I was invited by the Great Science Museum in Australia, in Canberra, and Graham Durant. So he showed me the entire museum. He said that, Parag, there is physics and mathematics and everything in the museum. I just asked him that, is there an empathy section in your museum? And he said, Parag, why? I said, empathy is a science. If you are calling yourself as an empathy science museum, why not there is a section on empathy? And he literally said that, Parag, I think we should really fight with the Australian government that science is not only science STEM, which is science, technology, engineering, mathematics. It is beyond that, and it should be empathy. So I think empathy is going to be the cutting line. Empathy has to be precursor. Since morning, we are hearing empathy, empathy, empathy everywhere. I think we should really work very powerful as an organization, because this is a gifted organization of making a change in this world. And I'm really happy to be part of Inspire to Live. Thank you.
It's been a really amazing panel, and this is the beauty of Inspire to Live. We have people from Asia, Africa, Europe, and Latin America. All the continents are here. So thank you. It's been very interesting to learn about empowerment, awareness, education, and of course, empathy. So words that we will still continue talking about and discussing and reflecting about. So thank you to all of you. And I don't know if there's a question. I know we are super late, but if there's a question for any of the speakers here. Okay, so I think everybody's hungry now, right? Do you have a question?
I have a comment, if you don't mind. Because of their two presentations. And I just said, I sat in a conference, the first breast cancer and cancer conference I had ever attended, and we were waiting in line to take lunch. And my colleagues who were breast surgeons were saying, Nigerian women cannot come early. And there was a stirring inside my stomach, and I'm like, which one of us has given them information? How do they know they need to come early? How do they know that what they have can receive an attention that can help them? The typical thing is when we go on rural outreaches, we see women with fungating breast lesions and are hiding it. And that was what took me out of my comfort zone eventually to form a cancer NGO. Just like you did, Franklin. Somebody has to inform them. We have so much information. And anytime the Nigerian Medical Association will invite me to talk, I will tell them I'm not saying anything except to tell us we have a responsibility. We are the custodians of the health of our people. And we are there sitting in our comfort zones waiting for people to be sick so that we treat them instead of going out there to give them information that can save their lives. So I think this is so critical. Thank you very much.
Thank you again, all of you. It's been really inspiring to hear your stories. And of course, because you all took action to advocate. We all each of you faced very different challenges in your own settings, but you all stood up and made a change. So thank you for that. Thank you for what you're doing.
Thank you. Thank you so much. I once heard that stories is data with soul. And I think the stories that we've heard, they're the ones that activate action. And because Inspire to Live is all about action, Purella dabbing her eyes. But it is, we've heard those stories, and those stories that we have, the way in which we share them. And I think the biggest takeaway for all of us, I hope, is this idea. We need to move from I, me, myself, to we, to together, to collaboration, to sharing, because together is better.